Good day, everyone. My name is Tyshawn McGregor, and I'm a student at the Valdosta State University. Today, I'm here to provide substantial information on the impact of cholera in Indonesia. The outline of my presentation will be mainly focused in the following areas. Indonesia is located in Southeast Asia with a chain of over 17,000 islands. This nation is the fourth most populous in the world, with more than 50% of its people living on the island of Java. It is known for its abundance of natural resources, but yet poverty remains widespread. With the three main branches of government, the administrative provinces are subdivided into regencies and districts. Each district has its own respective governor and lawmakers. Various provinces consist of distinct classes of Indonesians. Indonesia is also known for its variety of over 300 ethnic groups. Each class has formerly been based on hierarchy and income. The provision of healthcare, education, and water varies in each district. An article from the Journal of Advanced Nursing mentioned that most hospitals operate on a user-pay system. Each classified hospital's A through D provides a certain number of service practitioners and other health amenities. Each hospital also consists of certain classes of individuals. After the 1998 economic crisis, also referred to as Crimson, the quality of healthcare diminished over the years. Less privileged citizens cannot afford the high cost of healthcare, so they seek treatment from community health centers that are subsidized by the government. Indonesia also receives free health aid packages from the International Monetary Fund and the World Bank. Diarrheal diseases are the major causes of mortality and morbidity in developing nations. The morbidity rate for cholera in Indonesia is 7.8 per 1,000 population per year. This is the third leading cause of morbidity in the country. Cholera affects small intestines when food is contaminated with Vibrio cholerae bacteria. The bacterium thrives in the mucus of the walls of the intestines and produces toxin proteins that give infected individuals watery stools and makes them dehydrated. Symptoms occur within 12 hours to 5 days of an infection. Untreated individuals are likely to die. Street foods are urban phenomenon in developing nations. The table on the right comes from a report from the Journal of Biosciences. Food and beverages are often prepared by vendors in the streets or public places. Study shows that these street foods could be contaminated with the Vibrio cholerae bacteria during the preparation steps, and they can actually cause food poisoning in adolescents and teens. Most cases of cholera are often reported from northern Jakarta, where persons dwell in overcrowded regions with poor sanitation and limited access to clean water. FEM's Immunology and Medical Microbiology also conducted a study to determine causative organisms that are associated with diarrheal diseases. About 4,000 patients were gathered, and each patient reported symptoms of diarrhea, fever, and abdominal cramps. Stool samples reveal isolates of various bacteria such as Salmonella, Shigella, and two strains of Vibrio cholerae. The Vibrio cholerae strains indicated the possible cause of diarrhea in affected patients. 7 pandemics of cholera occurred globally from the mid-19th to the late 20th century. Between the 1960s and the 1970s, the 7th pandemic of cholera began in Indonesia. It spread through North Africa and ended in the South Pacific with more than 155,000 people killed. PLOS neglected tropical diseases also reported a culture positive cholera cases among Indonesia, India, and Mozambique. Research shows that Mozambique had the highest reported incidence of cholera while Indonesia had the lowest incidence. Tetracycline is one of the most effective antibiotics that is used to treat the Vibrio cholerae bacteria in cholera. This four-membered ring structure actually acts as a protein synthesis inhibitor and binds to the 30th subunit of ribosome. It is often sold as brand names such as Samicin and Tetrasin. Chloramphenicol is a bacteriostatic antimicrobial that is produced by the Streptomyces bacteria, and it was found in the late 1940s. Like tetracycline, it's a protein synthesis inhibitor that binds to the 50th subunit of ribosome and inhibits peptide bond formation, and it's often sold as Chlorcic or chloromycetin. Like tetracycline, ampicillin is another important antibiotic that is used to treat patients that are suffering from cholera. This structure consists of a beta-lactam ring that is involved in irreversible inhibition of the enzyme transpeptidase, which most bacteria actually use in the synthesis of their cell walls. Antibiotics were once considered the first line of defense against cholera. However, studies have shown that frequent uses of antibiotics leads to increased resistance by the bacteria. Some antibiotic-resistant mechanisms include efflux pumps, spontaneous chromosomal mutations, and conjugative plasmids. The Journal of Medical Microbiology globally compares some of the antibiotics that are commonly resisted by the O1 and non-O1 strains of Vibrio cholerae. For Indonesia, antibiotic resistance is greatly shown against ampicillin, tetracycline, and chloramphenicol. The government of Indonesia needs to improve quality of water and sanitation standards. This is one of the most effective ways to avoid cholera. Oral rehydration therapy is also a common method to treat affected individuals. This regimen includes a suitable quantity of sugars and salt water that helps to prevent dehydration. Research has shown that it decreases over 50% of mortality rates in children under 5 years. Cholera remains a public health issue that needs to be addressed immediately. Indonesians need a better healthcare system to accommodate affected individuals. Although antibiotics have been formally effective, other safety measures should be adopted around the home.